Right now, more than 6 million Americans are living with a chronic wound, and many don't even realize how dangerous these wounds can be until it's too late. Chronic wounds can affect anyone, but they're especially common in people with diabetes, circulation problems, or mobility issues. In this video, we'll take a closer look at the most common types of chronic wounds, what causes them, and, most importantly, why specialty wound care is critical for healing and preventing serious complications. So, let's start with the basics. What exactly is a chronic wound? A chronic wound is an injury that fails to heal in the expected time frame, usually around 4 to 6 weeks. Instead of closing up and repairing itself, the wound stays open, gets stuck in one phase of healing, or even gets worse. Why does this happen? In most cases, there's an underlying health issue at play, like poor circulation, high blood sugar, repeated pressure, or even infection. These underlying problems slow the body's natural healing process and can create a dangerous cycle. Chronic wounds aren't just uncomfortable, they increase the risk of hospitalization and, in severe cases, amputation. That's why understanding them is so important. One of the most well-known types of chronic wounds are diabetic ulcers. These usually appear on the feet. Here's why. People with diabetes often develop nerve damage, which means they lose sensation in their feet. Combine that with poor circulation, and it creates the perfect storm. Patients may not notice a small cut, blister, or sore. Over time, that minor injury can turn into a severe ulcer. Without the right care, diabetic ulcers are the leading cause of lower limb amputations in the US. That's the scary part, but here's the hopeful part. With specialized wound care, like tissue allografts, advanced dressings, and glucose management, many of these ulcers can heal completely. This is why early wound care matters. It can literally save limbs and lives. Another common type is the venous ulcer. These usually appear on the lower leg or ankle and are caused when the veins in the legs can't efficiently pump blood back to the heart. Blood starts pooling in the lower legs. That extra pressure damages the skin and tissue, eventually causing it to break down. Venous ulcers are incredibly stubborn. They can last months, even years, without healing. The important thing here is that these wounds aren't just skin problems, they're tied to deeper vascular issues. Without addressing both the wound and the circulation problem, true healing is very difficult. Not all surgical wounds heal as planned. While most incisions close within weeks, some become chronic. Why? Infection, underlying conditions like diabetes, poor circulation, or simply the body's reduced healing ability as we age. A surgical wound that reopens, stays inflamed, or fails to heal needs immediate attention. Now that we've reviewed the most common types of chronic wounds, let's talk about why specialty wound care is so important. Chronic wounds aren't just a bandage issue. They require a deeper level of expertise. At specialty wound care clinics, treatment goes beyond surface-level dressings. We use advanced technology like Moleculite DX to detect bacteria in real time. We use allografts to promote new tissue growth in wounds that won't heal. And we build personalized care plans that address not only the wound, but the patient's overall health and lifestyle. The goal is always the same: faster healing, fewer complications, and better quality of life. So here's the big takeaway. If a wound hasn't started to heal in 2 weeks or hasn't fully healed in 6 weeks, it's not just a cut or a sore anymore. It's a chronic wound and it needs advanced care. At Specialty Wound Care, we believe healing isn't just about what happens in the clinic, it's about empowering patients, supporting providers, and using the best science and technology available. If you found this video helpful, hit subscribe to stay up to date with our latest educational content on wound care. And if you'd like to learn more about the services we provide, visit us at specialtywoundcare.com.